Excellencies, ladies and gentlemen, this conference coincides with the 7th anniversary of Merck Foundation. On this occasion, we appreciate its numerous programs and interventions to support capacity building in the medical field, by extension, transform people's lives in the medical field, and by extension, transform people's lives. The Foundation truly plays a vital role in promoting women's health and addressing critical healthcare challenges such as infertility, cancer, diabetes, and other health conditions. I, therefore, wish to congratulate the Merck Foundation's leadership, staff, and partners for the important milestone achieved in the past 7 years. Congratulations. Tanzania takes great pride in partnering with the Merck Foundation. In just a few years of our cooperation, we had witnessed notable progress. We valued this partnership, which has enabled around 70 Tanzanians to undertake short and long-term specialized and advanced medical training programs. And it is our wish to deepen this partnership further in the years to come. Ladies and gentlemen, 9 years ago, United Nations member states adopted a shared blueprint in the form of the 17 Sustainable Development Goals, or SDGs. Among the goals envisioned were to ensure healthy lives and promote well-being for all at all ages, and to ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. To realize all the SDGs, a note was made on the need to strengthen the means of implementation and revitalize the global partnership for sustainable development. I, therefore, welcome this 11th edition of the Merck Foundation Luminary Conference's focus on these 3 goals, namely health, which is goal number 3, quality education, goal number 4, and partnership, goal number 17. This conference is timely given that this year's progress report on SDG reveals that only 17% of SDG targets are on track to be achieved, while over a third have stalled or even regressed. As we endeavor to meet these goals, substantial investment, urgent actions, and keen interests are required. Therefore, the anticipated discussions during this conference are critical. We must build dynamic and focused partnership and ensure effective coordination and collective action. As such, we expect to be enlightened through exchanges by distinguished participants from healthcare providers, leaders and policymakers, academia, researchers, and media stakeholders. On our part, Tanzania, a lot has been narrated by my Minister for Gender Development and Generation Equality, but we continue to meaningfully contribute in these important discussions. Excellencies, ladies and gentlemen, I'm aware that the Merck Foundation has great interest in health and education domains, and so my government. I will touch on what we have done to realize our commitments in these 2 domains. Number 1 is health, and as a woman and mother myself, from when I was the Vice President and since becoming the President, I've placed a great priority in improving child and maternal health services in the country. Between 2021 and 2023, we increased access to healthcare or healthcare services by investing and developing over 127 district hospitals and over 367 healthcare facilities countrywide. We increased the number of health facilities that provide maternal and child health services from 340 in 2021 to over 523 by the end of 2023. As a result of various interventions, our 2022 demographic and health survey showed that maternal deaths dropped from 556 per 100,000 in 2015 to 104 in 2022. A drop of over 80%. Equally, the survey showed that child deaths dropped from 67 per 1,000 live births to 43 per 1,000 live births, a reduction of around a third, and still much needs to be done around this area. While acknowledging these positive developments, more remains to be done to meet our goals for maternal and child health. In particular, we envision continuing investment in specialized health services and facilities. One of the challenges that we encountered due to additional facilities or health facilities is the shortage of qualified and specialized manpower. So our thanks are to the Merck Foundation that supports us in training the doctors in specialized fields. And in this regard, Tanzania will continue to work with the Merck Foundation so as to produce more doctors in specialized fields. Another area that is also dear to you, as it is to me, is investment in education. In this vein, I wish to recognize and applaud Merck Foundation's Educating Linda program. This is a laudable intervention, which will have a great impact not only to the girl child, but also to their communities. It is also fitting that the word Linda in Swahili means to protect, which is exactly what this program aims, to protect the dreams of unprivileged young girls. As the old adage says, if you educate a woman, you educate a nation, and this is exactly what we are doing. I, along with all the women here present today, are living testimony of how education can empower a girl child. As a daughter of a teacher myself, I witnessed firsthand the transformative role of education. Indeed, education is a source of women empowerment and emancipation. Education combines with determination, perseverance, and patience, enables women and girls to achieve outstanding results in all their endeavors, including in leadership, which some of us have dared to partake. Truly, with these attributes, there's no limit to realizing girls' full potential. In this regard, education has continued to be a priority for my government, and we have undertaken key transformative interventions in this sector. During the past 3 years, we have built over 3,000 primary schools and over 500 secondary schools across the country, bringing the present total to 20,533 primary schools and 6,269 secondary schools. Among the schools that we have built are 24 girls' boarding schools as part of our plan to build girls' boarding school in each of our 26 regions of Tanzania mainland. In ensuring access to education, we have continued to provide free education for all children from primary to secondary levels. and the numbers of primary school students have risen from 10.6 million in 2021 to 11.4 million this year. And in secondary schools, the numbers have risen from 2.38 million in 2021 to over 3 million in this year. All these interventions help to ensure access to education for our girls and boys. As for the content of our education, we also undertook a review of our education system to make the shift from assessment-based learning to competence-based training. We have also increased funding for higher levels of education and have introduced a new scholarship to support youth to go into science, technology, engineering, and mathematics subjects in higher education or higher studies.